Welcome to TMED presentation on diseases of the blood vessels, based on Chapter 7 of BRS pathology. Today, we'll explore various vascular conditions, including their pathophysiology, clinical features, and treatment. Blood vessels form the foundation of the circulatory system. Arteries, veins, and capillaries have distinct structures and functions. Disruptions in these systems can result in conditions like atherosclerosis, aneurysms, and vasculitis. Understanding these diseases is crucial for managing complications like ischemia, organ damage, or systemic conditions. Atherosclerosis is a chronic inflammatory condition of the arterial wall. It begins with endothelial injury, progresses with lipid accumulation and foam cell formation, and leads to plaque development. Key risk factors include smoking, hypertension, and high cholesterol. If left untreated, it can result in major complications like heart attacks and strokes. Atherosclerosis affects various vascular territories. Coronary arteries atherosclerosis can lead to angina or myocardial infarction. Cerebral arteries atherosclerosis increase stroke risk. Peripheral arteries atherosclerosis can result in claudication or gangrene. Diagnosing involves imaging like angiography, and treatment ranges from lifestyle changes to surgical interventions. For diagnosis, angiography, CT/MRI, and ultrasound can be done. The management includes lifestyle modifications, diet, exercise, statins, antiplatelet agents, and surgical interventions, e.g., angioplasty. Aneurysms represent localized dilations in blood vessels. Aortic aneurysms, for instance, can be life-threatening if ruptured. Common causes include hypertension, atherosclerosis, and connective tissue disorders. Imaging modalities like CT or ultrasound help diagnose aneurysms, and treatment often involves surgical repair. Vasculitis involves inflammation of blood vessels and varies by vessel size. For instance, large vessel vasculitis includes giant cell arteritis. Medium vessel vasculitis includes polyarteritis nodosa. Small vessel vasculitis includes Wegener's granulomatosis. Symptoms depend on the organs affected. Early diagnosis with biopsy or imaging and treatment with immunosuppressants is vital. Giant cell arteritis primarily affects the temporal arteries, leading to inflammation, pain, and reduced blood flow, commonly affecting older adults. The symptoms like headache, jaw pain, and vision changes. Diagnosis often involves an elevated ESR and a temporal artery biopsy. Prompt treatment with corticosteroids can prevent complications like blindness. Takayasu arteritis is a rare disease predominantly affecting young women. It involves the aorta and its branches, causing symptoms like arm claudication and blood pressure discrepancies. Diagnosis relies on imaging such as CT angiography, and treatment includes corticosteroids and immunosuppressive agents. Polyarteritis nodosa is a small and medium vessel vasculitis that can affect various organs, causing symptoms like muscle pain, hypertension, and fever. It is sometimes associated with hepatitis B infection. Diagnosis requires tissue biopsy, which shows transmural inflammation and fibrinoid necrosis. The treatment involves steroids and immunosuppressive therapy. Vasculitis often presents with systemic symptoms like fever, weight loss, and fatigue. Organ-specific symptoms depend on the vessels involved, such as renal failure or neurological deficits. Early diagnosis with imaging, biopsy, and inflammatory markers is critical for effective management. Chronic hypertension damages blood vessels over time, contributing to vascular conditions like atherosclerosis and aneurysms. It leads to vascular wall thickening and narrowing, increasing the risk of strokes and kidney failure. Managing hypertension through lifestyle changes and medications is key. To recap, we've covered atherosclerosis, which is a major cause of coronary artery disease, stroke, and peripheral arterial disease aneurysms, that is an abnormal dilations of blood vessels that can rupture and cause life-threatening bleeding. Vasculitis, where inflammation of blood vessels that can affect large, medium, or small vessels, leading to ischemia and organ damage. And the impact of hypertension on vascular health. Early diagnosis and tailored treatments are crucial for managing these conditions. These references include BRS pathology and additional clinical guidelines. Please feel free to explore these for deeper insights into vascular diseases. Subscribe for more educational videos.